lap. Um, Actually, I just got married last weekend. It is changing to Manly. Um, so hopefully Blackboard will have that updated for you guys soon. I am currently a registered nurse at a local Syracuse hospital, and I work with a cardiac surgery and vascular surgery service line. Um, I am currently, when I return from my honeymoon next week, we'll be transitioning to a cardiovascular ICU role. So I'll be orienting for that. I am in SUNY Upstate's 3-year FNP program, going part-time. My future as an advanced practice RN, not quite exactly sure what route I want to go yet. I have been specialized with cardiac surgery for about 6 years or so now. So I'm interested in seeing, other clinical opportunities, if I have interest in anything else, but I do love cardiac surgery, so maybe I will head that route. The main purpose of my video tour today is obviously cardiac surgery, coronary artery disease. It's an interest of mine. I figured that this could serve as maybe a future tool for patients. Cleveland Clinic is a hospital that we are affiliated with our cardiac surgery service. We sometimes will refer patients to the Cleveland Clinic. They have a fantastic cardiology service there. So I just kind of wanted to explore what they have to offer for their patients and family members. So I came across this website just by Googling coronary artery disease. I tried to put myself into the perspective of a patient or a family member of a patient who has been diagnosed with coronary artery disease to give myself a general idea of what they are faced with. So I came across the Cleveland Clinic website. I decided to check them out. Overall, you open the page, it looks very clean here, very straightforward, easy to read. It's well organized from what you can tell. As you scroll down, you can kind of see a good pictorial that'll give patients and family members, an idea. It's not, and it doesn't contain everything with the anatomy and physiology of a heart, obviously, but it just gives a very general overview for these people seeking basic information. So it gives a, very broad background on what coronary artery disease is for those that are, newly diagnosed or just looking up information. It's very straightforward. You can see here, how they describe atherosclerosis as a hardening or clogging of the arteries. Really puts it into layman's terms for these people, making it easy to read for those who may not be so medically inclined. Again, you can see it down here. They refer to angina as chest pain using, very basic terminology for these people. Background of coronary artery disease, and it gets a little more in-depth here, describing some coronary syndromes, MI, STEMI, NSTEMI, angina, ischemia, definition. So this first page here really just kind of gives an overview of coronary artery disease. What I really like down here, as you continue to scroll, it talks about risk factors for coronary artery disease. non-modifiable and modifiable, which I think is important to make people aware of what they can do and to kind of promote autonomy for these patients to take control over their health. And, looking at this from a patient perspective, they can, maybe see that their blood pressure could have better control, or their diabetes could have better control. They could become a little more active. And these are the things that can really hopefully resonate with these patients and family members to start making better choices in their lifestyle to decrease their risk factors. It goes on again to talk about how coronary arteries actually narrow. We don't need to quite get into all of that now. As you scroll down, it gives a real clear pathway on how to navigate this site. So I feel like those who are not as technologically inclined would have, a pretty easy time trying to navigate and find things on this site. It's very clean and uncluttered. Again, up here at the top, they have the tabs where you can directly go to specific topics without having to scroll all the way up and down. This next page, after talking about the overview of coronary artery disease, gets into the diagnosis and testing that may be done for those who, maybe were just newly diagnosed. They want to know how they were diagnosed and what tests they may be facing. Nuclear imaging, ultrasounds, x-rays, CTs, MRIs, that kind of thing. It gives a very basic overview, as well as the option for learning more about that. So say, a patient was recently diagnosed with CAD, they're going to have to go for a cardiac cath, or they have a strong family history, they've been symptomatic, having chest pain on and off for a while. They can check out and click on more tabs to different resources here. So the website is very easy to navigate as we click on the different topics. It gives another pathway via the Cleveland Clinic for patients to find more information should they want to know more specifically about a topic. Again, you get to the bottom, you can continue on or go back. Here we'll continue on to the management and treatment. So it gives a nice chronological orientation for these patients and family members. The management and treatment, again, it reinforces for people what they can do to decrease their modifiable risk factors, quit smoking, lower cholesterol, your blood pressure, increase your activity, medication compliance, and again, it talks about common treatments of CAD, such as cardiac cath, angioplasties, and of course coronary artery bypass grafting. And again, these highlighted tabs here, you can click, that'll lead you to get more information about a topic, if that's what the course of action is for these patients. Here, I think it's also important to note that with these interventions that are listed, angioplasty and open heart, it gives a little information for these patients to know that, yes, they will increase circulation to the heart, but it will not actually cure your coronary artery disease. You will always have that. And the importance here is to maintain and keep in control your risk factors and your lifestyle. Here you continue on. The Cleveland Clinic lists their resources that they used for this information here. It also gives the opportunity with their links to follow up with more information. And of course, if you want to contact the Cleveland Clinic's Cardiac Institute, become a patient, those kinds of things are very closely linked. It gives frequently accessed topics that correlate with coronary artery disease here. So should you want to know more about diagnostic testing, the anatomy, it also gives support services for families and patients, which I think is very important. Of course, promotional information for the Cleveland Clinic. But overall, I really think that this is a great tool for patients and families. It gives a generic and broad coverage of coronary artery disease with the options for seeking more intense information should somebody want to know more. I think the importance of using this as a tool for patients and families is basic information, so it's not as overwhelming. Again, I think the point that really is focused on here, because it's talked about more than once, is risk factors, both non-modifiable and modifiable. It is touched on again. Sorry, I was scrolling kind of fast. Under the management and treatment, as well as the overview. So that's the most important thing here for patients, and I really like how they have dedicated an entire tab here, a separate page for resources for people. That's including support services as well as referrals for centers, clinics, management, and treatment options. Over here, I haven't really talked about the right-hand side very much as well. It's more information on related topics, so I won't really click into this and delve into this, but it talks more about coronary artery disease, MIs, coronary syndrome, bifurcation blockages, coronary occlusions. So these quick links here can serve as a resource as well for patients and family members. I did not actually try to chat with a heart nurse, but this allows for that automated messaging system to get in touch with the Cleveland Clinic. And here is their contact information. Actually, should you want more information or want to become a patient at the Cleveland Clinic. So great tool for patients. I did score using the SEER score rubric for this website at a 3.8, which is a credible and reliable source, giving it greater than a 3.5. So that's about all that I have here with the Cleveland Clinic and coronary artery disease. Thank you.